Desperate times, risky measures, Maine hospitals, California buyers, and a troubling history? Let's get into it.
The CEO of Central Maine Healthcare took questions from the public about a potential system acquisition and made his case for the transition.
Our communities deserve better health care than we are able to provide, and we have an answer.
CMHC announced earlier this year, California-based Prime Healthcare Foundation is vying to acquire the Central Maine system by this summer. The deal would require Prime to invest $150 million into CMHC over the next 5 years. A panel of leaders from both organizations were in attendance at tonight's public information session that was held in Lewiston. Central Maine Healthcare CEO Steve Littleson says the system's hospitals are struggling to keep up with inflation and they're in debt with aging, neglected facilities.
If you think about that combination, a lot of debt and really old facilities, it just makes for a very challenging environment in order to keep up with the technology and the demands of providing state-of-the-art patient care to people who really deserve it.
Representatives said tonight the hospital names within the CMHC system would not change, nor would the staff.
Welcome back, y'all. This is Drew Hoagland with Mainstream Current. And before I get into the rest of the video, let's go ahead and check out another video from another news station here in Maine. Let's go.
The acquisition agreement was announced today. The nonprofit Prime Healthcare Systems wants to take over operations here at CMMC, as well as all the other facilities owned by Central Maine Healthcare. The agreement comes with a $150 million investment, cash flow that comes at a time Maine hospitals are struggling.
The status quo is an erosion of services, reducing access, and really, some of our hospitals and systems that are in trouble.
President of the Maine Hospital Association says post-pandemic, a staff exodus and economic inflation has been a financial gut punch to healthcare providers. CMMC isn't immune to that. Our partners at the Sun Journal report the hospital ended 2023 with a $20 million deficit.
The frustration I think we felt is just not having access to all of the infrastructure that we need to support and fulfill our jobs fully to serve the community. And so access to this partnership will make that come to fruition.
Prime's nonprofit foundation is operated by Prime Healthcare, which owns 44 hospitals across the U.S. And they haven't been without controversy, with 3 settlements with the federal government, mostly over alleged Medicaid fraud. The company did not admit any wrongdoing, but in one case paid out $65 million. They also agreed to enter into a 5-year compliance program of enhanced federal monitoring. But the company's investment in Maine comes at a critical time.
That level of investment could and would preserve, if not expand, access to some key services.
The acquisition is not finalized quite yet. It still faces government and regulatory approvals. In Lewiston, Anna Kuhn, CBS 13 News.
All right, so you could see from the 2 videos that we just watched that Prime Healthcare is trying to, by all apparent measures, do a good thing. Obviously, hospitals are incredible. They're needed in a civilized society. We need them here in Maine. Maine, we have the highest population of elderly people in all 50 states, at like 23-something%, which doesn't seem that high. But when basically a quarter of your population is over the age of 65, you need to invest in hospitals. So the question isn't about whether or not this is necessary or warranted. It's obviously warranted. We obviously need to figure this out. My question is this the way? Like, is this the solution? Because I did research into Prime Healthcare, and they've had multiple settlements in the millions, in in the double-digit millions range. The largest amount being $65 million that they had to pay out in false allegations. So this is from justice.gov, the archives of the U.S. Department of Justice. Prime Healthcare Services and CEO to pay $65 million to settle False Claims Act allegations. I'll just read a little bit real quick. Prime Healthcare Services, Inc., Prime Healthcare Foundation, Inc., and Prime Healthcare Management, Inc., collectively Prime, and Prime's founder and Chief Executive Officer, Dr. Prem Reddy, have agreed to pay the United States $65 million to settle allegations that 14 Prime hospitals in California knowingly submitted false claims to Medicare by admitting patients who required only less costly outpatient care and by billing for more expensive patient diagnosis than the patients had, a practice known as upcoding. The Justice Department announced today, under the settlement agreement, Dr. Reddy will pay $3,250,000 and Prime will pay $61,750,000. I don't know about you, but ain't no way I'm gonna pay someone $3 million if those are false allegations. Like, if you're gonna accuse me of a heinous crime like that, you better have receipts and you better buckle up, because you best know that I will have receipts and I will follow up and countersue or whatever I need to do, because there ain't no way I'm gonna spend $3 million to just shut a conversation down because they're false. No, if my name is being dragged through the mud like this, Dr. Prem Reddy, then I sure as hell am not gonna sleep until justice has been served. So my question is, why would Dr. Prem Reddy agree to pay $3 million of his own personal money and then Prime to pay $61 million? That's a lot of money. And that's a lot of money if it's especially false allegations. Like, it cost a lot to go to court, but the cost of having your name drawn through the mud, run through the mud, like, that also cost. It makes people question, it makes people wonder, like myself, and then I'm going to put it online, and then more people are going to wonder. So if they're really false, is that the best move to do? Is just paying $65 million to shut down the conversation really cheaper than having it go to court and decided that you are actually you're the victim, Prime in this case, not these false claims? Or are those 14 hospitals actually culpable and there is receipts and someone wanted to shut the conversation down for $65 million because in all likelihood they would have to pay back the US government far more money? I'm just asking questions here. In this video, I don't have answers. I'm just asking questions. I'm bringing this forward because this came up in my research over and over again. And as like a learn with me kind of channel or a grow with me kind of channel, research with me kind of channel, that's what I want. So I want to show you where I am in my research and how I got to where I get. So this is part of it. So I'm just sharing what I found and I'm asking questions because I don't have answers, but I do wonder if there's a better way to do it than what we're being propositioned with. Because this is a lot of money and we're outsourcing it to another state, and it's a nonprofit, but it's also Prime as a whole. Do we need to keep outsourcing things that our state needs to other states? Or do we figure out a way to keep the resources and technology and skill force here in the state while attracting those from outside of the state, but benefiting Maine in the long run? Like, can we do those things at the same time? So I just am asking questions. So also in this, There is Central Maine Healthcare expands mission in agreement with Prime Healthcare Foundation. So this is from CMHC.org. Central Maine Healthcare. I don't know what the last C stands for. The Central Maine Healthcare, CMH, Board of Directors and Prime Healthcare Foundation, PHF, announced today that they have reached an agreement for PHF to become the sole corporate member and parent company of Central Maine Healthcare, pending regulatory approvals. Under the agreement, Prime Healthcare Foundation, headquartered in Ontario, California, a 501c3 public charity founded in 2006, affiliated with Prime Healthcare and operating 14 not-for-profit hospitals in 6 states, would become the owner of all CMH services and facilities, which will retain their current names and local leaderships. PHF will offer substantially all CMH team members positions at comparable wages and benefits, and they will honor provider and physician contracts. I did research before I filmed this video, and I guess I didn't realize that Prime works with 14 hospitals, and all 14 hospitals were falsely accused of filing fraudulent claims against the US government. Not just one, several times, not just a couple, several times, but all of them. No wonder $65 million is sounding a lot like the cheaper end of the deal, if you ask me. So, I don't have any answers, but this did come up in my research, so I'm curious as to what y'all think. Go ahead, like, share, subscribe, get this out there. I'm trying to raise questions and get answers and just have everything move and try and get to the bottom of this as a state. And my whole point is I don't like the idea of our money, our resources going out of state when they could, in my opinion, just as easily stay here in the state. Yes, things would need to be reconfigured. Yes, we would need to have a deeper conversation about the complexities of the healthcare system. Yes. But just because we need to have those conversations doesn't mean we don't do it. It just means we need to plan it. We need to make time, and we need to research and look into alternatives, because a nonprofit with a lot of allegations against it in the court of law doesn't seem like the smartest move on our part. Yes, they are going to bring in $150 million, allegedly. How much is blood money? How much is fraudulent? And it could be all good. We do need the hospitals, so don't get me wrong. We need these hospitals. I just wonder if there's another way to go about doing the same thing. Why don't you guys let me know down in the comments what you think, because I like hearing the feedback and I like getting the responses and trying to get to the bottom of some of these really complex issues, and it helps me know where I'm going to go in future videos with research and what I say. Alright, y'all. Until next time, this has been Drew Hoagland with Mainstream Current.
Ready? Fight!